Imagine being able to wake up with energy, sleep better, not have body aches, not be depressed, don't feel fatigued and sluggish all day. My name is Dr. Maz. I practice at MedWell Spine and Neuropathy Center in Midland Park, New Jersey. We are a panel of doctors and physical therapists working together at one location. I'm also the author of this book, How to Live Pain-Free and Happy, Drug-Free, Non-Invasive, Non-Chemical, Non-Surgical Steps for Resolving Chronic Fatigue and Fibromyalgia. I'm going to make a bold statement. Ready for this? Fibromyalgia is treatable, and it is not a muscular problem. It is a neurological problem. The reason you're watching this video is because either you or someone that you know is suffering from chronic fatigue and fibromyalgia. The purpose of this video is to inform you what is available and enable you to be able to enjoy life with your family and friends. What if I tell you there are painless, non-invasive, non-surgical, non-chemical solutions to treat fibromyalgia? What if I tell you information about fibromyalgia and chronic fatigue that pharmaceutical companies don't want you to know? So I want you to listen carefully. You can grab a pen and a piece of paper to write notes as you wish. Let's define fibromyalgia and chronic fatigue. Fibromyalgia and chronic fatigue affects millions of Americans. It is characterized as you have pain all over your body, being chronically fatigued most of the time. Many of my patients say they feel like they have the flu 24/7. Or you have difficulty with movement, even putting one leg in front of the other. The treatment protocol that you will hear and that I'm about to tell you has helped hundreds of fibromyalgia sufferers for the past decade successfully. I have studied over 10 years of latest research in diagnosis and treatment of these series of conditions. I'm also trained by the country's leading expert, Dr. Michael Johnson. The problem with fibromyalgia is that there is no lab tests or blood work or imaging studies that confirms it. Most fibromyalgia patients are diagnosed by rheumatologists, the doctors who specialize in arthritis. And when all tests are normal, the diagnosis is fibromyalgia. The patient gets labeled as fibromyalgia. The doctor may say to the patient that they're even faking it. I've had cases like that. Their doctor said they're faking it. All the lab tests are normal. It is in their head. They need to see a psychiatrist. Studies show that there has to be 11 out of 18 trigger points throughout your entire body. Well, sometimes there is 8, sometimes there is 16. Not everybody follow the book. I had a patient that it was costing their marriage. She was fatigued and depressed all the time. She didn't want to do anything just because of fibromyalgia and chronic fatigue. The problem is that there are many disciplines treating one body. I say all the time, healthcare is simple, doctors make it complicated. If you're depressed because of fibromyalgia, you have to see a psychiatrist. If you have indigestion because of fibromyalgia, you have to see a gastroenterologist. If you have fibromyalgia, you see a neurologist or a primary care physician. That could be one of the reasons. You have a sick body that makes your symptoms. Your symptoms do not make your body sick. Your body shows those symptoms. So we have to treat the whole body. I know what you're going through, and if you don't treat it, it will potentially get worse. The cause of your symptoms is overactive midbrain. What happens? Your midbrain is in the middle of your brain. It has a top, middle, and lower. Normally, brain fires the lower brain stem, and the job of the lower brain stem is to make sure the upper brain stem do not overwork, do not fire more than what it should. Now, when the upper brainstem, it keeps on firing, you lose the firing pattern. You cause a lot of problems. It is called neocortical thalamo-hypothalamo-pontomedullary reticular activating system. It took me 3 years to be able to say that. I'll tell you up front, I'm not a professional speaker. I don't get in front of the camera often, but I'm a doctor that you could depend on. The problem is that loop is not working properly. You lose the proper synchronization of firing, or for a lack of a better term, your brain is not physiologically working properly. Why? Because of stress. Stress causes physiologically your brain not to work properly. Now, stress could be physical, chemical, or emotional. An example of a physical stress is if you had a car accident. An example of a chemical stress is if you drink a lot, alcoholic beverages, if you smoke, that's chemical stress. An emotional stress is if you have been abused as a child, if you have been sexually abused, if you're being verbally abused, divorce. Those are emotional stress. Now, when you're stressed, the body releases cortisol from your adrenal glands. Adrenal glands, they're on top of your kidneys. Now, cortisol is toxic to your brain. That is why when you're under a lot of stress, you cannot think straight. You have trouble with your memory. So clinically what happens, the upper brain stem, when it keeps on firing and it's working more than it should, cortisol gets released, and as a result the adrenal gland produce norepinephrine and catecholamines, and those, they go through your system, they release and stimulate type C nociceptive receptors. There are the small pain receptors within your body that get stimulated. So when they get excited and stimulated, they go and travel throughout your body in your bloodstream, and it could cause, one day you have neck pain, the next day you have back pain, the next day you have knee pain, the next day you have headache, the next day you have digestive problem, you have one day constipation, the next day you have diarrhea. So that is why you drive yourself crazy to diagnose this. The doctors, they look at the symptoms and they try to fix the symptoms.
After I came to MedWell, after one visit, honestly, I felt so much better. After the first visit, I slept for 5 hours straight, and now I'm, 3 hours, 5 hours, and I'm getting REM sleep, which I have dreams, which means, I'm getting a better quality of sleep.
So, what makes us different and unique is that we treat you and diagnose you metabolically and neurologically. We do not want to leave any stone unturned. Our goal is to investigate the true cause and treat your body as one, as a whole unit, not different systems. We define what is the actual cause of your problem. We design a diagnostic and treatment plan to address the cause, and we deliver the treatment on site. There may be certain lab tests that needs to be done to assess the true cause of the problem. First is a blood test. Now, blood test is complete blood count, blood chemistry, comprehensive thyroid panel, lipid panel, metabolic panel. I guarantee you all the lab tests that I'm telling you, you have not done them. You may have done a thyroid test. I don't care about only TSH. I care about TSH, T3, T4, thyroid binding globulin, on and on and on. It's a comprehensive thyroid panel that needs to be done, in addition to the other blood tests that I mentioned. Now, I want you to understand, when you look at the blood test, or when we look at your blood test, there is a lab ranges that are from X to Y, it's normal. And there's functional ranges. We have to look at the functional ranges. The functional ranges are a lot narrower than the lab ranges that are given on your lab report. For example, for one of the lab tests that you do, the results supposed to be from 75 to 100. Well, there's a difference if you're 76 or 99. That's why we look at the functional ranges. The next test is food sensitivity testing. You may have food sensitivity testing in this office. You may be allergic to certain foods that you don't even know about. We're going to test you with gluten, eggs, milk, soy, or yeast. And you will not get better if you don't identify it and fix it. The only way to know if you are food sensitive is to get tested. Now, you as a patient, you may say, I'm not food sensitive. Why should I do that test? Well, you don't know it, and you're not qualified to know it. The test will tell you if you're food sensitive or not. Similarly, people who have a heart attack today does not mean their heart was healthy yesterday because they had no symptoms. That's why they do echocardiograms, to see how is your heart functioning. So, food sensitivity testing is another test that needs to be done. On most of our patients, it is done to see if you're sensitive to gluten. Because if you're sensitive to gluten, you're not going to get cured, no matter what I do or anybody else does. And that is why you may have the symptoms still. The next test is adrenal stress index test. Adrenal stress index test is important because adrenal glands, as I said, they're in charge of your cortisol production. Cortisol is supposed to be at its highest at 3 p.m. in the middle of the day and its lowest at 3 a.m. in the middle of the night. Now, we're going to test you throughout the day. Now, if you have high cortisol production and secretion in the middle of the night, that is why you could not sleep, and that could be very well the cause. Like I said, healthcare is easy. Doctors make it complicated. To go to different doctors for different symptoms and different conditions, that makes it complicated. We need to treat you as a whole. And the answer could be as simple as that. You may have a H. pylori or leaky gut syndrome. What is that? That means if you have any bacterial, viral, or parasitic infection in your gut, that will attack your nervous system and your immune system. And if that doesn't get fixed, you're not going to get fixed, no matter what medication anybody gives you or what treatment anybody gives you. So we have to assess and diagnose you metabolically and neurologically. The neurological aspect of diagnosis is doing different brain screenings. Eyes open, eyes closed, testing your balance. That's testing the back part of your brain called cerebellum. You may do finger to nose test, finger to finger test, and other neurological maneuvers. We may have you do vascular testing to see if you have enough circulation to your arms or to your legs, if need be. So how do we treat fibromyalgia? We treat it metabolically and neurologically based on what we find. The treatment is not exercise. Yes, exercise is good, but if you cannot put one leg in front of the other, how can I expect you to do exercise? The treatment is not necessarily only medication. Unfortunately, fibromyalgia patients have to play Russian roulette. They go to their doctors, they're given medication. If this medication doesn't work, they take another medication. If that medication doesn't work, they up the dose. If that doesn't work, here, try this new medication. Usually, the medical doctors give you medication. A common medication is trazodone. Trazodone by itself causes sleep problem. That could be very well the cause. Fibromyalgia patients, they cannot sleep. That is the first thing that needs to be handled because it affects your life drastically. The reason that you can't sleep, 90% of the time we have found it's overactive mesencephalon, the upper brain stem. When you do not get REM sleep, it causes something that we call brain fog or fibrofog. Means you're not cognitively with it. The simple things that you're supposed to remember, you don't remember. You get to a place, you don't even know how you got there. You mess up calling your children's names. These are called brain fog or fibrofog. There is reasons behind that.
I came here feeling awful, and that doesn't even describe it. If I could say I thought it was hell, I would say that. Now I feel great. I have 2 days with no pain, and you guys are, if I could say, you're angels from heaven.
I just don't know what else to say except that I am almost 100% mended. and it's thanks to MedWell. My pain is zero in comparison to the excruciating pain I had when I came in.
Now, the left brain is the judgmental and analytical side. It's called a happy brain. If it's not working properly, you get depressed. That's a physiologic phenomenon. Many of my fibromyalgia patients, they're depressed because they cannot find a doctor to help them. Because they take different medications, and not only they have the side effects of the medication, but it doesn't help them. As soon as they stop, all the symptoms come back. In addition, if the upper brainstem keeps on overfiring, overworking, that could cause digestive problem, irritable bowel syndrome, constipation one day, diarrhea the next day, feeling gas, heartburn after a meal, on and on and on. Many times, the problem could be cerebellum. Cerebellum is the back part of the brain. If it's not firing properly, it causes a spinal-related problem. It causes back pain. It causes postural muscle pain. It causes sciatica. It could cause dizziness. It's in charge of your balance. If it's not working properly, it causes balance problem. You may become light sensitive because the upper brainstem has the third cranial nerve going through it, and if it keeps on firing, you become light sensitive, and your pupils cannot constrict when you have light. I guarantee you, you have some inflammation in your body that you need to get rid of, because we all do. You don't probably know this. Inflammation causes aging. Excess inflammation expedites aging. I'm giving you an alternative. I'm giving you a painless, non-invasive, non-surgical, non-chemical alternative method. Investigate it. Sometimes my patients bring in supplements. They see something on internet or their friend gave it to them. I have never seen any supplements that cures a problem. They may help the problem, but I have at least not seen anything that cures a problem. I actually personally give you some supplements, or our doctors over here, they give you supplements to help you get cured. But it's not going to be in replacement of the cure.
Dr. Maz is one of the most caring, compassionate people that I've ever met.
I gotta admit, it was like nothing I've ever had done before. His thorough examination covered every detailed aspect of me. I don't think I've ever had a more thorough one, to be honest with you.
He's really helped me with my fibromyalgia. Gave me some definite hints and techniques on nutrition and what I need to do there with those. And then, his adjustments and getting my body and getting my energy aligned really helped me out. And now I'm getting to the point where I really don't have a big problem with my fibromyalgia anymore. As a matter of fact, I think it's going away.
So the neurological treatment is geared towards slowing down the upper brainstem that keeps on firing. We may give you hands-on treatment by licensed physical therapists. We give you olfactory stimulation, that's the smell. If you smell vanilla or peppermint, that slows down the upper brainstem. We may give you eye exercises. We may give you other treatment that is neurologically geared towards slowing down the upper brainstem. Another thing that makes us individual and unique to what we provide is brain-based therapy. Brain-based therapy is part of the neurological aspect of treatment. What is brain-based therapy? The pain that you have is perceived in your brain. That means any pain that you have in your body, it gets interpreted and perceived in your brain. For example, if you have leg pain or if you have arm pain, you have locally, you have some problems, and physiologically in your brain gets interpreted as pain. So we have to treat you locally and give you brain-based therapy. Okay, so if we treat you only locally, that's not enough. And that could be the reason you're not getting better, because everybody looks at you locally. Nobody gives you brain-based therapy. But brain controls all your body functions and movement. If physiologically it's not working properly, it's not going to 100% help you. Your brain needs two things to survive: fuel and activation. Energy and proper amount of signals to work properly. Now, the fuel part, it comes from glucose and oxygen. Glucose is handled metabolically and it's given to your brain. So we have no problem with that. But the oxygen is the key, because oxygen is extremely important for your brain to work properly. Brain does not store oxygen, your muscles do. Back part of your brain is called cerebellum. It is the most oxygen dependent part of your whole entire body. Not only your brain, your whole entire body. Now when cerebellum has enough oxygen supply, it works properly. What cerebellum does, it communicates with your brain cortex. Brain cortex communicates with your lower brain stem. Your lower brain stem communicates with your upper brain stem called mesencephalon, not to fire excessively, not to work too hard. Now, if there is not enough oxygen in the cerebellum, this loop doesn't work properly, and it causes the cerebellum to have oxidative phosphorylation. And as you age, unfortunately, your ability to utilize oxygen diminishes about 1% after the age of 25. So this means if you're 50 years old now, your ability to utilize oxygen has diminished 25% already. That's statistics. So we may be oxygen deprived. Now you may go to your primary care physician if you're skeptical and say, well, I listened to Dr. Moss from MedWell Spine and Neuropathy Center. He told me I may be oxygen deprived, and he ran a test on you and finds out you're not oxygen deprived. The reason for that is because the tests that are run, they're based on your cardiovascular system. It is not because of your neurological system. And that is why when we give oxygen treatment in the body to our patients, they feel better, because almost all of us, we are oxygen deprived. Because most of us who come to this office, they're over 25 years old with fibromyalgia and chronic fatigue. Now when there is not enough oxygen supplied to your cerebellum, your mesencephalon, it keeps on working too hard. That could cause by itself insomnia, digestive problems, chronic pain all over the body, dizziness, visual disturbance, heart problems, urinary tract infections, and of course chronic fatigue. So we have to give enough oxygen to cerebellum so the upper brain stem doesn't keep work too hard. So it slows down. It is essential to do that. So how do we take care of that? We give you supervised oxygen treatment on-site, prescribed by our medical doctors. What other treatments we give you? The treatment that works. The treatment that is painless, non-invasive, non-surgical, and non-chemical. We may give you whole body vibration. We may give you hands-on physical therapy. We may give you stretching and strengthening exercises, depending on individual cases. Metabolic treatment is essential to be done as well. First and foremost, we give glutathione treatment. Glutathione is mother lode of antioxidants. You all have heard of antioxidants. They're imperative and important to have to get rid of free radicals, to facilitate oxygen delivery to the cells. And the strongest antioxidant that I know, you can Google it yourself, is glutathione. We give you brain-based treatment based on your specific needs. You may need orthotics, foot orthotics. There are inserts that go in your shoes. We scan your feet, and based on your feet, we make 100% customized orthotics for your feet. So for feet, as you walk, you have proper biomechanical stand. If you have improper biomechanics, that could cause knee pain, low back pain, mid back pain, or even neck pain. That's why it's important to have proper foot biomechanics. So ask yourself this: how has your condition have affected you? Affected your family, affected your job or relationship? Is it affecting your lifestyle? What is it costing you not to be able to do what you want to do?
I was literally crippled when I came in and couldn't sleep at night, and I have to say that at this time I could sleep all night, through the night, without pain meds. I don't use the cane,
I just can't believe the difference between my condition when I came in and today.
Where do you picture yourself in a year from now? In 3 years from now? You think if what you have been doing was working, would you be listening to this DVD now? Probably not. You have to change to get different result. Where do you see yourself in 5 years from now? If you're serious to correct the problem, you need to contact our office. If you don't care about your health, please do not contact our office. I do not need to do this anymore. I do this because I have a passion to help people to live better, and I have been fortunate that I could facilitate that. You can get treatment or not get treatment. It doesn't make a difference in my life. Are you ready to open the combination of your life? You guys are all here because you choose to be here to get rid of your symptoms, pain. By doing what I'm going to go ahead and tell you to do, I'm going to enable you to get your life back. So you don't have to suffer with pain, numbness, neuropathy, tingling. You won't be able to experience chronic fatigue, tiredness. That's why we're all here. We're going to define, design, and develop a treatment plan that's going to be effective and enable to get your life back. So one more time, you can get up in the morning and you had a restful sleep and you haven't lost your mind.
I just want to thank everybody at MedWell. Everybody here is great. They know the pain you're in and they try to take care of it really quick. Thank you, MedWell.
I'm very thankful that this place was here. It was an accident that I came here for it, and it worked very well. And thank you, and MedWell, and thank you girls for smiling at me. It makes an old guy feel good.
Your health is not your doctor's responsibility, not your employer's responsibility, not your government's responsibility, and not your insurance company's responsibility. It is your responsibility. If you want to continue taking medication for the rest of your life, please do not call our office. Sometimes people who are skeptical about care, they say that they went to their doctor or they want to go to their doctor to see what their doctor thinks about this. And my response to them is that if your doctor knew how to treat you, you would have been treated by now without taking medication or pills anymore. Your doctor is treating your symptoms and is not treating or fixing you. We need to fix you and your symptoms will disappear. There are only a handful of selected doctors in the northeast of the United States who are trained in what we do. If it makes sense what I said to you, call our office. I'm asking you permission to help you. If you're serious about getting your symptoms handled, our office is for you. Call 201-848-8000. Not everyone is accepted for care. We only accept patients who we feel that we can truly help. So if what we have said to you has made sense to you, call our office. And one of our new patient coordinators will be glad to help you. When you come to our office, you may get treatment the same day or the following visit, based on how busy we are and what treatment we would recommend. Unless you're coming from out of state, then we treat you the same visit. The treatment is painless, non-invasive, non-surgical, and non-chemical. Can we guarantee it? No. Are we successful? Yes, very successful. I will look forward to seeing you in the future. You can call our office at 201-848-8000. Yes, we accept most insurance plans, and God bless you and your whole family.